Welcome. Thanks for joining us, everyone. My name is Andrew Phillips. I am the business manager at Phillips Accountancy Corporation, and I want to thank all of you for joining us today. Those of you who have signed up either through our website or through one of the emails that we sent out, really appreciate having you. Of course, as we get through this, it's a recorded webinar, so there's no chance for you to ask any questions. However, we'll get some contact information for our speaker here at the end. And of course, if you have any questions at all, you're welcome to ask them or ask me, whatever's easiest for you. Here with me today is Ali. Ali's the founder and CEO of DocSites Incorporated. DocSites was created really to address an overwhelming need for quality websites and online marketing services at a great affordable price. It requires no work from the dentist or their staff. It's basically fully, they cover it entirely on their end. Their products consist of elements basically for a dentist to succeed online. And we have a number of clients that have used their services and just find them fantastic. So Ali, what is teledentistry?
Thank you, Andrew. Thank you for having me. And I look forward to this webinar. And again, thank you so much.
You're very welcome.
This webinar will cover teledentistry, what it is, what it's not, how dentists are using it post-COVID, and also how your website ties into it to bring it all together for a good patient experience, as well as helping you gain new patients during this time that everything seems to have changed a little bit. So teledentistry is basically an online platform between the dentist and the patient. They communicate virtually, kind of like how Andrew and I are doing now. However, it's through a HIPAA-compliant platform. They have to consent to it. And how it works is basically you and the patient are talking as if they're in your chair, but they're actually in the home or they're in their office or wherever they have their device that they're using to speak to you with. These appointments consist of anywhere from follow-ups to appointments to new patient appointments to checking up on your treatments, as well as prescription-based appointments or things of that nature. We work with a partner called Denteractive, and they have a great teledentistry platform, which if anyone is interested in, you can ask me at the end of this and we'll have our contact info. And I'll show you guys a couple slides to cover how it works, how it looks, and how patients are using it. So teledentistry is basically how you could talk to your patient without actually getting him in the office through a HIPAA-compliant platform that is safe to use, private, and since medical information is going back and forth, it should be all encrypted through the platform you use. We have heard of some dentists using FaceTime, Zoom, or other apps of that nature for their teledentistry. Again, some of those you might want to check legally if that's HIPAA compliant or not, but as long as you have them consent and you're using some kind of encrypted platform to speak to them, it should be good to go. So kind of I'll show you guys a few slides right now to cover how this looks and how people are using it. I'm going to share my screen. So you can see here the platform consists of usually an app where the dentist has an account. They could message, they could video call, they could set up appointments, and they could pass information back and forth with the patient. As you can see, they could text with the patient, patient could send them pictures, x-rays, talk face-to-face on video, and that communication helps the client and the dentist know whether that's hey, you need to come in right now, that looks urgent, or let me prescribe you some antibiotics, or give it another 2 weeks of healing time and then make your appointment with us. So those kind of things are helping people. Now that this pandemic has happened, a lot of people, and you know how some offices were closed and weren't able to see patients, have been using teledentistry in order to keep their business moving, in order to keep patients informed, and in order to follow up with treatments they've already started pre-COVID, and also gain new patients during COVID. So it's been a very useful tool, and it wasn't as popular as it is now before COVID started, but people are using it right now. Even if their office is open, a lot of people use it in order to create that initial contact with the patient or prospective patient in order to get people in their chairs. So you could also see this app has, you know, the names of the people they've been talking to. You can schedule appointments with them through the app. Patients are sending pictures of their teeth, of the, you know, their issues, what hurts, what doesn't. And it's really become something that patients could use. And everyone now is texting, using video, FaceTime, and everyone's used to this new Zoom world we're all in. And it's become quite a tool for everyone to use during this time. And I believe after COVID's all said and done, that this will continue, and it actually will become a great tool for dentists to use to make that initial education / sale to get that new patient in their chair. Another thing that you might want to know is that doing these teledentistry, your insurance company and the patient's insurance carrier, typically they actually now pay for these appointments. There's different codes now that just started. I believe before COVID, there was only minimal companies that used to accept insurance for teledentistry appointments, whereas now many of the companies are doing it. There's actually codes that are involved with this, and people are using these codes in order to get people to their doors. And also, if your insurance is paying for it, you could highlight that on your website and say insurance could cover it. And I believe dentists are charging anywhere between $50 and $100 for these appointments should someone want to pay cash for it. So it's affordable for the patient. It's a great tool. It gets them in the seat if you could get them, you know, if it's a new patient. And for patients that you're following up treatment with, it's a great way to, you know, create some safety guidelines with not bringing people in the office if they necessarily don't have to be there, and just be able to show you their issue or say, hey, my implant is healing, or, you know, my braces are bothering me, or whatever the case may be. They're able to do these minor and low impact treatments over the teledentistry platform. And that definitely helps both the dental office, the patient, and to maintain that social distance that we're all accustomed to today. I'll give a little stopping point here and wanted to know, Andrew, do you think the audience has any questions at this stage? Or,
you know, at this point, I don't know that I certainly don't have any questions. I think you've kind of explained that part so far really well. I just want to chip in and say, you know, I think it's one of the things that we at Phillips Accountancy are always trying to do is we're trying to stay front of mind for our customers, our clients. And so I can see how something like this would help their a dentist patients keep the office front of mind with them, because that, you know, instead of having them come in, you know, you're still meeting with them, albeit virtually. So I think it's fantastic. And as far as we are right now, I don't have any questions. Thanks, though.
Great. So now we'll go into kind of how to use teledentistry as an appointment, and how to use it, one, for your current patients that you're treating, and two, for new patients. So if you have your current patients that you've been treating and now they may be hesitant to come in due to COVID, or, you know, you guys were closed for some time, these patients still had maybe some lingering treatments that they have to come in for. So you could always follow up with them through this platform, through teledentistry. They could send you photos of their teeth, their healing, their, you know, braces, whatever the case may be, how their veneers are looking, maybe a crown fell out or anything of that nature. So now people could share this with the dentist and say, here's how I'm feeling. It may not be as necessary for them to come in and, you know, go through the appointment, but at least, like Andrew said, you're in front of their mind. They remember you. You keep them basically in your radar to keep them always coming back. And once this is all over, they'll appreciate the time you spent, you know, being with them on teledentistry, using these virtual platforms to educate them on their case. And also, if something does need some urgent appointment, then you know, by looking at their teeth or their mouth or whatever they're complaining about, that creates the need for them to come in and schedule that appointment. So you could say, hey, I wouldn't, you know, leave that at home the way it is. I recommend you come in right now and we check it out. And that creates that appointment for you. And it also creates a little bit of that trust factor between, hey, you know, I'm not just having this appointment just for an appointment, but I really have an issue that the doctor saw on his camera, and I'm showing him what's going on, and he recommends an appointment. So that's when they actually come in and create that in face-to-face appointment. And then the other side of it is using teledentistry for new business, which is getting new patients. So on your website, which we'll cover in a minute, you always want to mention, if you're offering this service, that you do offer it. Many people find dentists online. When they find a dentist online, before COVID, they would either pick up the phone or use the web form to create an appointment and then go in and see the dentist. And that dentist would have to basically educate / sell them on why they should use them for whatever the problem was, versus now where you could do it on your device through teledentistry. So that also makes it easier for the patient to say, hey, before I go in, and you know, people are not always looking to go to the dentist, unfortunately. So this creates that one barrier of comfort that lets you basically teach them or educate them on how important it is to come into the dentist's office. And if they're a new patient looking for some treatment, whether it's cosmetic, braces, follow-up, root canal needs, or they need a tooth extracted, or whatever their needs are, you're able to talk to them face-to-face over this teledentistry platform and mention the importance of why they should come in and why they should use you. Why are you a good dentist for them to choose as a new patient? And then in that way, you get a new patient, they end up coming in, you treat them well, that's your patient for life, and you've used that teledentistry appointment basically as a sales tool. And we will cover a little bit of selling here, because you know, some people don't like to hear the word selling, but it essentially is a sale when you get to talk to someone and you get to educate them on why they should use you. Why not? The guy could go on any dental website and click an appointment form, and they might not get a response from you before the next guy on the list in Google. So the immediate follow-up, the scheduling, that teledentistry helps you create that first point of contact to gain that trust of the patient to then come into your office and create that new patient appointment. So many people are doing some free consultations before and after COVID. So you could use this teledentistry platform to create that free consultation to say, hey, you may be in need of braces, or you know, you're looking at veneers. Here's the estimated cost, what to expect, why I'm a good candidate for veneers, and why choose you for the veneers or for whatever treatment it may be. So you want to use this teledentistry platform as a way to get new patients. So that's how you get them in. But then for them to actually know you're offering teledentistry, that's where the website comes in, because without the website, how would they know you're offering teledentistry? Without finding you, they would never know you offered, unless they call you through some old-fashioned way of the yellow page or some directory, which isn't really the case anymore. Most people go to Google now, they search dentist near me, they search, you know, veneer specialist, they search Invisalign special around me, or, you know, they put their city, state, and they put dentist, and they find a list of dentists. Now they're going to go through the list and they're going to see who they like to see based on the personality they show on the website, the reviews they have. The cleanliness of the website directly reflects to the cleanliness of your office. So if you have an old website that may look outdated and broken links and things of that nature, they might correlate that directly that, yeah, your office might be outdated, your equipment might be outdated. So make sure that if you do have a website, you definitely keep it up to date, so the patient gets that trust factor. You show them who you are, you show them your expertise, you show them your great reviews, and that will give them a much bigger chance to hit that schedule the teledentistry appointment and become a new patient for you. I'll stop here for a minute, check in with Andrew, see if there's any questions, and then I'll go into the website portion of the presentation.
You know, at this point, same thing. I actually don't. I'm normally when we do these, it's kind of funny because I'll actually have some questions for the presenter, And I feel a little bit bad right now, Ali, but you're just kind of covering, maybe our brains are in sync because you're just kind of covering every question as I'm like about to think of it. So I hope to have a question for you later, but I really don't right now, bud.
No worries. If there's any questions at the end, our contact info will be there, and there's, you know, absolutely no obligation. You could call me. I'll give you guys my cell phone. You could text me and ask me any questions you have. And there's no obligation to buying anything. I'll give you all the free information in the world that I could offer you. So the next, I'll go ahead and share my screen again, and I'll share it to show you guys kind of the main elements you want on your website, not only for teledentistry, but even if you don't offer teledentistry, why you should have these elements on your website to get that appointment, the call, or create that trust factor to get the new patient. Teledentistry will just be one bonus, another way of getting that contact, whether they call you, they use your appointment form, your contact form, or use the teledentistry appointment is a great way to get a new patient. The benefit of using the teledentistry as the first point of contact is because they see you face to face. They're able to share with you their problems. They're able to maybe show you a picture, and you're able to tell them why and how they should come see you. And basically, you have to sell them on why you're the best person for their needs. And that's kind of with any business, whether it's dentistry, our business, accounting. The person that's paying for the service wants to know why they should pay you. And the teledentistry appointment is a great way to create that first meeting between you and the patient in order to get that case from them. All right, so I'm sharing my screen now. Okay, so question number one, do you even have a website? Many do. I hope most of you do. If you do, is it up to date? Does it have some of the elements that's required today, which is it mobile friendly? Does it have your contact info easily available? Can they click to call? Can they submit a form? And does it have your info, your credentials, your associations, and your experience on why you're the best dentist for them at that time? So having a website is very important, and it comes down to trust, right? If your website creates that initial trust, whether it's by your great reviews, whether it's by a picture of you and your staff, whether it's by your education or a special offer you have that may be interesting. If someone's looking for Invisalign and you have a special offer that says, hey, I'll do a free consultation, you could use that teledentistry appointment for the free consultation. Or you could say, hey, I'm giving $500 off Invisalign, which many of our clients do, and that creates that initial call to action to get someone to call you and ask about Invisalign. So build trust and build it with your website, because typically the website is the first thing they see about your practice. They don't come into your office first, they go to your website first. So if that website, you know, which impression do you want them to see? Do you want them to see something that might scare them away, or something trustworthy, a good picture, smiles, you know, things of that nature, offers, reviews, things that give them a good sense of, hey, let me pick up the phone, fill out the form, or schedule this teledentistry appointment. And those things will make the difference between them staying on your website or going back to Google and clicking the guy in the list under you, you know, the next dentist in your city. So your website is your first impression, and you want to make sure that you capture them with a good first impression in order for them to create that initial point of contact. So how can you make your website stand out? It's some of the things we covered. Highlight your great reviews. If you have videos, get those videos on the website. Many dentists are reluctant to ask someone, hey, if you had a great experience, do you mind sharing this? Whether you could go share it on Google. You can't directly ask or incentivize for reviews, but you could say, just go share your experience. And obviously you want to ask that from the people that are happy with you. And you want to make sure that they're using the correct platforms, whether it's Yelp, Google, or Health Grades, or many of these review websites that people are using. Even your Facebook page is one of the easiest places to get a review. Get those people to get you reviews, and there's apps out there, or there's links that you could provide them to make their life much easier to get you the reviews. And many dentists are asking for actual videos, video testimonials. Those go a long way because it's the patient in your office basically saying how great you are. And why wouldn't someone want to call you if they're seeing somebody else say great things about you? Not everyone trusts a review. Not everyone trusts a testimonial that could be just text-based on your website, but a video goes a long way. And another item that makes your website stand out is personalized photos. So as you can see, these two samples, these are actual dentists with their staff. You know, this is what the patient will see when they walk into your office. You don't want to put a generic photo of, you know, that you found on a stock library and say, this is the dentist, and then they come in and see a totally different person. You want them to actually get a feel for who they're seeing, who they're talking to. If they call your office and Amy is the front office receptionist, when they walk into your office, Amy's going to greet them. So you want them to see a personal side of your office on the website. Add your biography, add your photo. Your iPhone right now or your smartphone, any smartphone could be a perfect way to get a nice photo. You don't have to pay for expensive photography or an expensive photo shoot. Just take a nice photo. Our company actually photoshops them if needed, brightens them up, cleans them up, makes them look very nice. Put them on your website. Put a nice bio, write how long you've been doing it, your associations. Are you an implant expert? Are you a cosmetic expert? Even if you're just only like to do general work, you'd like to promote, maybe some casework, some before afters, an office tour. All these things go a long way into creating trust for the patient to schedule that teledentistry or make an appointment or call your office directly. Have a new patients page. So this new patients page, whether you have it in your main navigation or you have it somewhere else on your website, you want to make sure you have something that stands out to patients that you're trying to get, new patients that is. So if they click this new patients page, you want to talk about the insurances you accept, any care credit, lending club, any of these types of financing options you give people, and what kind of credit cards you may take. Text us, call us. Here's our patient form that they could download and fill out before they come in to save you and them some time when they come into your office. And really make use of your website to create that first step into getting that new patient. And on this page, now with the teledentistry topic, you want to add, we offer teledentistry. You want to make that somewhere prominent on your website that everyone knows, I'm offering this service. You could either contact me, call me, or set up a teledentistry appointment in order to get in touch with me, and we could just start with the teledentistry. And if you like what you hear, great. Let's get that appointment set up for face-to-face in the chair.
Now, Ali, if I could just interject real quick with that teledentistry part on the website, do you recommend that dentists give a very brief explanation of what teledentistry is for their patients? Or do you think it's best for them just to call and kind of ask? What do you think?
Yes, they should definitely at least give a brief, and I'll show you a couple of the next slides have some samples like that. So yeah, most people might not know what teledentistry is. I think now with COVID, a lot of people do know because, medical, dental, and most fields right now are using, some people call them virtual appointments, some people call them telemedicine, teledentistry, online health consult, whatever they're called. You do want to kind of explain to them what it is. And I'll show you that in the next slide, but I just wanted to show you number 4 here is have a great follow-up system. So if someone actually contacts you for teledentistry or calls you or if they're making an appointment through your website and no one calls them back or takes 2 days to call them back, you're going to lose that potential new patient. So have someone in place, whether that's your receptionist, yourself, whoever that is. When someone contacts you through the web, especially if they're a new patient, you want to jump on that immediate follow-up and impress them. Not only one, how quick you got back to them to take care of their needs, but how nice you are, how accommodating you are, and how you want them to trust you in order to actually come into your office. So make sure if you do have a good website, you're marketing, you're doing teledentistry, that you're also following up properly, because that's a big miss in our industry is people get the leads, but they're not following up with them in a timely manner, and that creates a loss of a lead. The lead might go off to another dentist, or just say, this guy took too long, I was in pain, I called someone else, I went to urgent care, emergency room, whatever it could be. That immediate follow-up goes a long way, especially if you're providing emergency dentistry. That really, like post-COVID, when dentistry was called non-essential for whatever reason, emergency dentistry became big, because you guys were promoting emergency dentistry. If people had major pain or something, you were basically helping out the emergency rooms by taking patients in and creating room for the COVID patients and pulling in people into your dental office and helping them. So if you offer emergency, same-day appointments, weekend or after hours, or any kind of emergency, make sure that's promoted somewhere very prominent on your website. And following up to Andrew's question, yes, so have those buttons or those banners or those links on your site. And as you can see, the thing says like HIPAA compliance, live text or video with doctor. So these things don't necessarily say teledentistry, because a patient may not know what that is. But if you say live text or video, they'll get the idea of, yes, I could actually text or video chat with the doctor directly, and that is what teledentistry is. And, you know, put that on your site, make it prominent. If it's the partner we use, Denteractive, has an app that they could download. You can make their life very easy by having these things already on your website and saving them jumping through hoops. And some of our patients, we're putting this yellow banner. We're now offering teledentistry, so every page they go to, they see this banner, they click here for more info. Like you said, they kind of learn what it is, see what we're doing, visit the dentist from the comfort of your own home, and make these things a little prominent for people to get an idea of what it is and why they should use it, and create that initial appointment through teledentistry to get that patient to become a lifelong patient. Once all this is over, you're going to see, hey, I might have got X amount of new patients just from a teledentistry appointment, or even just having a website and saying, call us right now, we're open, or we provide emergency service, or whatever that is. That call to action goes a long way on the website. I'll flip the screen off and stop here for any questions. And that kind of wraps up everything about teledentistry and your website. And just to kind of follow up with, so you have the teledentistry app or the program, you have a website, but now how does it get found, right? So you might have a great, nice new website, but no one's finding it. It's just like having the best new smartphone, but no one has your phone number and no one's calling it. So you want to make sure, if you do invest in a website, if you do take time to set up teledentistry and you're putting all these resources into getting these things set up, you want to make sure your website gets found. And how does it get found? Through internet marketing, whether that's search engine optimization, AdWords, Facebook ads, blogging, Google My Business, any of these things that all work together into creating traffic for your website. So if you optimize your website for, let's say, a dentist near me in your city or your zip code, or Invisalign specialist, if you're adding these keywords, or not you, but your company or your web guy or whoever you're working with. So that's what we do on a monthly basis for marketing clients, is we're adding content on their website. They say, hey, Ali, I want to focus on Invisalign or veneers or general. So every month we're adding content to their website and optimizing them for those things, such as, you know, dentist near me providing Invisalign. So when someone goes to Google and searches Invisalign dentist in Tarzana, for example, or Los Angeles veneer specialist, the chance of your website getting found is much higher because you have the content on your site. And the beauty is, once they get to your site, you have the teledentistry banner, or you have the make the appointment button, or whatever it is, and that call to action. All of these things work together into getting new patients. So not only can you use teledentistry for your current cases and following up and post-treatment and low-impact cases, or prescribing antibiotics or whatever it may be. But you could also use it as a tool to get new business. It's just another avenue, just like how a phone call and a form on your website creates a lead for you. Teledentistry is another avenue to gain leads. You just have to get them to see you offer teledentistry, which is where internet marketing comes in and the website.
So I understand that there's all these different ways to have the website be seen. Are these something that should be handled on? I mean, this is probably more of a topic for a separate discussion, but just since we're talking about it, is this something that we should do, that dentists should do individually, or should they or should they all be done together? Is it one or the other, or is it all combined?
They usually work better combined. It's very saturated now. Maybe 5 years ago when we were doing SEO and search engine optimization, we were able to add some keywords and sprinkle some content with some words, and there would be, but now since everyone's doing it, everything works together. The main component is the website. Basically, it's the mothership. Everything else, Facebook, Google, reviews, and all those things you want to feed back into your website. So what that does is your website is where someone gets converted, whether it's for that teledentistry appointment or to make a phone call to your office. So you use those other means like Google My Business, which is real big now, and you could post just like you do on Facebook. So what we do for our clients to create activity to get them more website traffic is not only do we add content on their website, we manage their Google My Business, which is the Google Maps listing. We post weekly to their Google My Business. We post to their Facebook. We manage their reviews. All those things work together in creating online activity, which makes your website move. So if Google sees a website that hasn't been touched for a year, no content, old copyright, date, nothing new, it crawls your website every month and sees what's new on here. If it sees a website, for example, there's two dentists in Tarzana. One has a website that gets updated frequently and one doesn't. The one that is updated frequently is the one that's going to place higher because Google respects, and you're basically earning positioning by making your website more valuable for the visitor.
Interesting. Okay. Well, fantastic. So I think so far we've covered basically what is teledentistry, what is it not, why is it more important now than ever because of COVID, and really how it should be used. And we've also kind of gone over the top 5 things, like must-have elements, so to speak, for the practitioner's website to increase teledentistry appointments. Before we get into, how can listeners get in touch with you? My last question is, what else, do you have anything else that you think is kind of critical for this that we want to add, or should,
Yes.
What do you have for us?
Just to kind of talk about COVID again. So many of our clients now, and we're advising this to people, and you don't have to do it, but what we're doing now is we're offering courtesy COVID updates, we call them. Basically, we want you guys as the dentist to create a comfort level for a patient is to add a COVID link, whether it's that yellow banner or a red link at the top that says safety, COVID safety protocols. And you want to put, hey, you just spent a ton of money getting UV lights, filters, aerosol suction, and all this stuff that you had to implement in your office. Make sure you're showing that on your website, because not only does that kind of reflect on the investment you put in to create that safety, but also it creates a comfort level for the patient to come into your office. Many people might be scared to visit a dentist now that COVID happened, just for the nature, not just a dentist, it could be anything, medical, grocery store, whatever it is, but creating that COVID safety link that goes to a page that explains, hey, my office has new filters, my office has UV lighting, my office has great PPE gear. Check out this picture of, the dentist all geared up, which many are doing on social media. And that really helps create that trust factor. And hey, this looks like a safe place. I know I need to visit the dentist. I'm not going to put it off and use COVID as an excuse. So let me go ahead and visit them because they're saying, hey, they're implementing all these safety protocols that make me more comfortable to visit the dentist.
Well, that's good to know. So I guess my last question here at this point, Ali, is I'm sure everyone that's watching is asking the same thing. How do they get in touch with you? How do they move forward in this process so they can also increase their teledentistry appointments in their practice?
I will share my screen right now. This is my personal cell phone number. This is not like a marketing list or phone number that you're going to be getting spam with. This is my personal cell phone number. Just text me your name, email, maybe mention Andrew's webinar, and just ask me whatever you want. It doesn't necessarily have to be for a product or service we offer. It could be, hey, this is the issue I'm running into. What do you recommend? And of course, if you do contact us through this webinar, we have special offers. We could take up to 50% off for any of our websites. We could give you a monthly marketing discount. We have a great teledentistry partner that could also give you our partner pricing. And I would just, take advantage of this. And like I said, no obligation. And what else we could offer is a free assessment. So any dentist looking for a free assessment of their web presence, we would provide that at no cost. Schedule a 5 to 10 minute review with myself. We'll do a Zoom meeting or whatever you want, a phone call, and go over, hey, here's the things I'm finding about you. You're not taking advantage of Google My Business. Your Facebook's outdated. Your website's not linking, or you have broken links. All these things that matter. Hey, you could use some good reviews here. Here's what I recommend for you to do on your website. And I could provide you all this information with no obligation. And if you like what you hear, then you could always hire us for the website and marketing. And if you need that teledentistry partner, we have exclusive pricing with them as well, and we could tie this all in together. Again, our products have no long-term contract. We do all the work. We have many options to choose from. We personalize it. So all these things I talked about are pretty much included in our products, regardless of teledentistry or not. But that teledentistry factor adds that additional avenue of getting your patients that appointment or lead or whatever it is you're trying to create. So it works with your marketing hand in hand. And as I was saying, also right now is a good time, whether you have a website with us or another provider, call them and say, hey guys, I want to add some information about COVID safety. I just spent a ton of money getting these filters or whatever it is you're doing. I want to make sure that the people that are coming to my office know I have this, so they feel more comfortable into picking up the phone or creating that appointment, because I don't want to lose business during COVID. And we say there's some dentists that are thriving during this time and some dentists that are just surviving, and you want to be the one that's thriving. You want to be the one that's saying, hey, I have teledentistry, I'm still marketing, I'm offering emergency, I'm offering all these different safety protocols to make you comfortable. And though that in turn there's some dentists that may be scared right now to do these things, and they might be losing on these. Because right now we've noticed, even in our marketing clients, their leads are picking back up just like they were pre-COVID, because people are now understanding, life at some point has to start getting back to normal. I have to see a dentist. I can't put it off anymore. So creating that extra layer of security for them by adding the COVID safety info, by offering teledentistry, goes a long way. So I highly recommend. Just text me, call me, whatever you like, and I'll give you that information whether you use us or not.
Exactly. And folks, one of the things that Ali mentioned just now was, reach out to him, and there's no obligation. If you don't like what you hear, you don't have to move forward with him. One of the great things that I like about Ali and his colleagues at the doc sites is you will like what you hear. Anybody that we've sent over there, they like what they hear, they end up moving forward with them. And I'm not saying this because we get any sort of a finder's fee. There's no sort of kickback involved from Phillips Accountancy or to Phillips Accountancy. For us, what matters is a quality referral with a quality firm like the doc sites. So when we say we recommend the doc sites for your website, for your marketing, that kind of thing, we mean it. There's no we don't get anything for it other than seeing the smile on your face when you say, damn, they did a good job. So Ali, thank you very much for taking the time out of your day.
Of course, anytime. And like we said, no obligation. You could take this
Exactly.
with it as you wish. And Andrew, I really appreciate your time, your effort, and thank you so much for the good words. And I hope people find this valuable.
Well, you're very welcome, folks. Thank you so much for joining us. Thank you, Ali, for joining us. And everyone, have a wonderful day.
Thank you.